At least 130 people have now died in the Ebola outbreak in the Democratic Republic of Congo. Latest figures also show more than 500 suspected cases, with the World Health Organization to hold an emergency meeting later. The head of the WHO says he is deeply concerned about the scale and speed of the epidemic.
This is the first time a Director General has declared a FIC before convening an emergency committee. I did not do this lightly. I did it in accordance with Article 12 of the International Health Regulations, after consulting the ministers of health of both countries, and because I'm deeply concerned about the scale and speed of the epidemic.
Well, earlier I spoke to Greg Ram, Country Director of Save the Children in the DRC. He's recently returned from the affected area.
The situation is deeply, deeply concerning. I've just come back to Kinshasa from Ituri province, the epicenter of the outbreak, and it's clear that we are just seeing the tip of the iceberg, and we need to get this under control. Ituri is a home of already a massive humanitarian crisis with conflict ongoing, so that will make getting this under control even that much harder.
What did you see there that has made you so concerned?
Well, one of the biggest concerns is that the health care infrastructure, which Save the Children supports, is still very basic, very rudimentary. There's not enough supplies of infection control, not enough chlorine, not enough protective gear for health workers, not enough body bags for safe and dignified burial. And so what we need urgently is to get those supplies in, to get messages out to the population on how to prevent the spread. And we urgently need contact tracing to make sure that all cases are traced and that we get this under control.
What's your sense of what the numbers may look like? There are concerns that this has spread much wider and deeper than the numbers suggest at the moment.
It's hard to predict at this point in time, but yes, until you get every case under control, it is hard to know. Initially, the testing was for the more common strain of Ebola in the DRC. Because this is a different and more unusual strain, it was not caught early on. It's now spread across different parts of Eastern DRC, and therefore the international community, Congolese health authorities are already mobilizing. We have to do more to make sure that we stop the spread. Children are dying. It is a critical situation.
What are people there saying? How much worry, concern is there from ordinary people?
Starting to see loved ones dying of what can't, even though Ebola is known, is seen as a mysterious and somewhat gruesome disease. And so people are asking for help. We need to keep health centers open so children with malnutrition or malaria can be treated. People are worried, and it's really important that the people of Ituri province and others not be forgotten at this time.
You said more help is desperately needed in terms of equipment and people. What are the authorities there saying about accessing that? Has there been much international response?
There's growing international concern and response. Funding is being mobilized. More is needed. Save the Children has large health programs in Ituri province and other parts of Eastern DRC. Save the Children and other humanitarian actors, the World Health Organization, Congolese government authorities are mobilizing, but time is of the essence to get equipment in, to get people in, and to stop the spread.
And Greg, what is your advice to people who are concerned about this in the country and in neighbouring countries? What are the symptoms and what do they do if they are worried they may have it?
Well, the first thing is, yes, if you have a fever, it may, and if you've been in contact with somebody who may have had Ebola, then get yourself checked, get yourself treated. In many cases, fever may be something else. So what you don't want to do is if you have a fever and you might have malaria and not get treated, those things can kill as well. So the main thing is don't spread fear, don't spread rumors. If you're sick, go to a health center and make sure that other people do the same.
Greg Ram from Save the Children in the DRC there.